Hey, I haven't put up a video in about 2 weeks, so I meant to do two of these a week, and I'm just all over the map. And if in case you can't tell from watching my videos, I'm going to try to be a little bit more concise on some things, and that way people can pick and choose what they want to listen to or do or whatever. In case you're doing it at work and you don't have 10 minutes to talk, watch my stupid video. It's not even about that. I mean, I'm doing this for me more than anyone else, just so that I can broadcast what questions people have been asking me multiple times, and try to give the information out. And obviously, some family and stuff that have not, that I'm not able to call them on the phone every day, and because they're all over the country, and friends and family, to give them the information that they need. So what I'm going to do is, if you see a video that says update, it's just going to be my updates. I'm going to try to make it quick, keep it under 5 minutes. A ramble is going to be, if it says ramble on it, you know what that means. That could be anywhere from 5 to 20 minutes. So, and that's just going to be me talking about whatever's going on in my head. So, this is just an update. Excuse me. I'm also going to have some art videos coming up soon. It's because I'm working on some art. I sent an email to, this is an interesting thing, I sent an email to a few different art companies that for companies that I use their art products, like the Grumbacher. They do watercolors and they have different paint sets and things like that. Canson is a paper company. They make watercolor paper that's really nice. And a few other companies, obviously, and then Michaels and Hobby Lobby and things like that. And Canson so far is the only one that's responded, and they responded with a real short email. I basically just explained my situation. I said that I was trying to put together something, and I mean, I wasn't necessarily looking for a sponsorship or anything like that, but I was just like, I want some supplies so that I don't have to go spend any money on supplies, because I feel like that's a misuse of any funds that I might be having coming my way right now. So try not to do that. And they sent me 30 pounds worth of paper. So I've got a lot of paper right now to make a lot of paintings with. So pretty happy about that. It actually came on my birthday, which was Tuesday. So already halfway through this video, and this is supposed to be an update. So real quick, went to get my pre-op information. Well, first off, I went to my oncologist, and it turned out I do have Lynch syndrome. So that's good news, because that means that I'm just more susceptible to having cancer in the colon specifically. I think there's a couple other types of cancer that I'm more susceptible to, but not as much. I think bladder cancer, maybe stomach cancer. But obviously they didn't find that before, so I'm clean there. We're going to move forward with, they took me off chemo. So February 2nd was actually my last chemotherapy treatment. And then that's so that I have a month to be off chemo and have surgery on the 29th, so that I'm able to heal. The healing process will go better because my new cells are developing, and I'm going to heal faster. So they do it a month. They take you off a month before, and then my surgeon would like a month after, but my oncologist wants 2 weeks after to go back onto chemo, and I have to do chemo for 6 months. So it'll be the same regimen I was on. Everything will be the same. It'll be every 2 weeks, same process. Nothing's added, nothing's being removed, except for possibly the oxyplatin, which is the one that gives you neuropathy, and you can't feel things in your fingertips, and it can become permanent, and that would really suck, because then I wouldn't be able to hold a paintbrush or type. That'd be bad. So, with that said, surgery on Monday. They have me doing a lot of different things. I've got to do like a fast on Sunday, all Sunday. Like, I can't eat all day. I can have clear liquids, and that's about it. And then I got to do like this special scrub thing that they gave me, like an antibacterial loofah. That's what it looks like. And so I've got to do that for the pre-op. And then when I get there at 6 a.m. on Monday morning, I got about a 2-hour wait. Go and talk to the surgeon. Go in. Bada bing, bada boom. Hopefully my colon comes out. And the greatest news is that I should not have a colostomy bag when I wake up. If I do, I will be in the 5% or 4% or whatever she said of patients that need it. And if that's the case, then you know what? Then I'm in a special category, and I guess I'm going to have to live with it and deal with it. I will be a little bit upset and maybe sad, but we'll cross that bridge when we get there. So yeah, that's it. That's about it. I'm waiting to get the surgery done. I'm probably gonna do one more video before my surgery to talk about heart stuff, or maybe I'll just ramble. Who knows? But yeah. So check the subject lines whenever you see them. That way you can differentiate if you got time to listen to it, or if you don't want to listen to it. Updates are going to be the important things. That's going to be the medical stuff. So trying to keep it where people can pick and choose what they want to watch, and they don't have to listen to me ramble on for 10 minutes because my brain is on chemo still and I can't form sentences sometimes. But yeah, so there's that. We're at 5 minutes and 30 seconds, so just a little bit over, but that's it. See you next time.